Hello and welcome to Community Health Journal. We begin today with two important questions. Do you know the warning signs of stroke? And do you know what to do if you experience stroke symptoms? Cadlick Regional Medical Center and the Richland Fire Department have teamed up to spread the word on the answers to these questions. On average, about once each day, a patient comes to Cadlick in the midst of a stroke. Experts say when symptoms occur, calling an ambulance is the first best option to getting treatment. For the symptoms of stroke, remember the word FAST. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
When we arrive at your house and we do that quick assessment and exam to determine whether or not you may be having a stroke, is we have the ability to call the hospital before you get there and tell them what's going on. So we can call from the field to the hospital and say, we have a patient we're bringing in, they're having a stroke, or we believe they're having a stroke. And that allows the hospital to get all the tools and the people necessary to get ready to take care of you as soon as you hit the door, because time is brain tissue, and EMS works very closely with the hospital to communicate.
Because treatment options such as TPA, you may have heard of that, it's a medication that can be given IV intravenously, and it can help dissolve a clot if that is the cause of the stroke. There are two types of strokes. There's the ischemic type, which results from a blood clot which obstructs the flow to a certain part of the brain, and then the hemorrhagic stroke, which results from a rupture of a blood vessel. And IV TPA can actually help with the type that results from a blood clot.
And I could really tell that something was wrong.
Deneen Scribner has an amazing story. She suffered a stroke 6 years ago in Illinois while running a 10K race.
I had to sit down at the where the race was, and I had to, at that point I had probably another runner come by and ask if I was okay, and I said I needed help. My voice was very weak. And then, pretty soon I had some EMS coming, and so they shipped me off to the hospital, so I was able to get help really quick.
Since moving to the Tri-Cities, Deneen has become an advocate for stroke awareness. She also regularly visits stroke patients at Cadlick, providing perspective and comfort to those who can relate to her experience.
I also volunteer here once a week here at Cadlick, visiting stroke survivors. They are survivors, not victims. And it just helps me in my journey, and I want to help other people in their journey as well.
Cadlick is part of the Providence Telestroke Network. That means whenever a patient is stricken, wherever they are stricken, expert help is close by. Doctors can connect instantaneously with the neurologist to make a diagnosis and initiate care.
We do use the telestroke cart. Basically, the doctor just calls into the cart, they show up on the screen, and they can assess the patient. So there's usually a nurse like me or an emergency department physician at the bedside that helps test the strength in the arms and the legs. They test the visual field, so they'll cover up an eye and see if the patient is losing any visual fields, and then they also test for sensation. So we can get a full assessment with that patient and get quick treatment.
The bottom line message: when stroke symptoms hit, call 911 right away. Time is brain. If you'd like more information about stroke symptoms and the warning signs, visit stroke.org.